then that's going to affect the knee, right? And I'll tell patients that if we don't have orthotics and we're not managing that, one of the ways that I'll manage it temporarily is I'll do an arch taping in the clinic. So if I feel like maybe minimizing some of this supination might be helpful, I'll put them in a neutral position here. Now this is a situation where I actually use... I shouldn't affect things, that's okay. That's all right. So what I'll do, now on the skin of the knee, which is a little more gentle, you're going to use the white tape on the cover roll as a base, then this is going to do the pulling. The skin on the foot is a little tougher, so we can go brown directly on there. Okay? So what I'm going to do, this is sometimes called a Lodi arch taping or a teardrop arch taping. What we want to do is maintain the height of this arch. Picture the plantar fascia, which goes from the calcaneus to the ball of the foot there. So I'm going to hold this here, and I'm going to come around across the arch and wrap around the calcaneus and come back up to where we started, forming like a teardrop shape. So looping around like that and coming back and touching where I started. Then I'm going to do another teardrop from the first MTP, coming across here. Try to minimize wrinkles, because wrinkles can cause blisters. So I have one teardrop going this way, one teardrop going that way. Now if I keep doing that, I usually do two more. And go here. So this tape's really strong and does not stretch very much. So when she stands on this, if I've connected these pieces of tape, you don't. Sometimes you have to use scissors to tear this. It looks cooler if you can tear it with your hands. Yeah. So this tape goes from here to there. So this arch, in order to flatten out, this tape would have to stretch. So now when she stands on this, go ahead and stand up. When she stands on this, that arch is going to stay a little bit more elevated. Sorry. It's going to be a little bit more elevated. So while I don't have anything structurally under here, by preventing that arch from flattening completely, I can keep her maybe a little closer to subtalar neutral. So then I'll have her do her exercises to walk around. If this works, if maintaining that arch in a higher position, then they may be a candidate for orthotics. Okay? So if I say, let's go try some custom orthotics, which can be $250 to $900, or maybe with some temporary ones, if I slap tape on them and that works, that may be justification to go ahead and try some orthotics in the shoes. Okay? So I'll tape them and then have them do some exercises and things like that. Okay?
Question.
Go ahead and sit back up. Yes?